People often ask me how I became a dental efficiency expert. The short answer, I guess, is that it's amazing what happens when you spend literally tens of thousands of hours studying the best and most productive manufacturers on earth, and then translating what they have learned into the providing of great dental care. But that's not really the interesting part. The more interesting part is probably why. There are many possible life choices. Why this? Here's how that happened. Many years ago, as a young, extremely poor dentist, I was fighting for survival. My area was in bad economic shape. The doctor that owned the practice that I was working in was all about him. I couldn't see how I could afford an escape plan based upon the amount of dentistry that I was able to do at the quality I was committed to. So, feeling sorry for myself, and it being half Irish, and it being St. Patrick's Day, that led to a pub visit and darts. There's a history of Irish philosophy. It usually includes a good bit of dark humor. So here's the revelation. I'm sorry that it didn't happen in a church and that it occurred that day in a dingy pub. But here goes. It turns out that it takes exactly the same amount of time for the dart to hit the wall as it does to hit the bullseye. Think about this in a universal sense for a moment. I did. It really should take no more time to do your work perfectly than it should take to do a poor job. In fact, when done poorly, it needs to be redone, taking even longer. The implications of this for me were massive. Every stroke of the burr, every rotation of a file, every elevation of an extraction, all have a best method, all have a best setup, all have an ideal result. This moment in time led to a lifetime of study, and here's what that's resulted in for ourselves and our clients. Over 33 million hours of time saved for both patients and doctors. Well over 13,000 hours for every doctor that we work with. I may have obsessed over this for 2 decades, but in perspective of those 33 million hours, and in addition to what that's done for patient comfort, it all seems worthwhile. And we're not done. Here's to the next 33 million. Thank you.